Good afternoon, everyone. Thanks for joining us on the briefing for this Wednesday. We'll go ahead and get started with our questions for public health and Dr. Moreno. Good afternoon, Dr. Moreno.
Good afternoon, ma'am.
So I do have if you've got questions for Dr. Moreno, go ahead and put them in chat. I do have a couple questions for you already, so we'll go ahead and get started. First question, a meta-analysis by Johns Hopkins University found that COVID forced lockdown policies, including mask mandates and the closures of schools and businesses, reduced COVID mortality in the United States and Europe by a mere 0.2%. The authors concluded that the lockdown policies are ill-founded and should be rejected as methods to control pandemics. Are you surprised by the results of that study?
Okay, thanks, Mia. You know, at this point, we're still in the middle of a pandemic, and we know that face coverings can protect individuals from getting COVID and protect individuals from passing COVID to one another. So Monterey County still following the state health officer order with regards to face coverings to try to slow the spread of COVID-19. And what we do know is evidence shows that the vaccines are the most effective way of preventing the spread of COVID. So Monterey County still continues to follow evidence shows that vaccinations are the most effective way of preventing the spread of COVID-19. And one of the things that we're very interested in trying to promote is keeping kids in school. So the combination of vaccines for those that are eligible and face coverings currently in school settings is helping us achieve our goal of keeping as many kids in the classroom as possible.
Thank you. Next question. Do you expect to see a rise in cases with the AT&T Pebble Beach Pro-Am in town this week?
We currently are in the middle of a surge, so we do have a high number of cases right now, and so it's very important that all events who invite in groups of individuals to meet do take precautions to reduce the spread and transmission of COVID among the participants of those events. So that includes use of face coverings when indoors, and when outdoors, if there's a risk that there's going to be a congregation where there's close proximity of people to one another, there's also added benefit of using face coverings in outdoor settings in those situations. So the local organizers should do their best to follow state guidance to try to minimize transmission while allowing participants to enjoy the events.
Thank you. Next question. Will you put a county mask mandate in place when the state's mandate expires if the local case count remains the same in 2 weeks?
So again, we in public health don't predict what's going to happen in the future. We know right now we're in a pandemic, and we've been under a health officer order for masking for over a year. We will continue to, at this point, follow the state health officer's masking order, and we'll see how this pandemic continues to evolve, and we'll wait and see at this point whether the state health officer is going to make any changes to his current health officer order.
Thank you. Next question. Have you seen any signs of the current spike peaking?
Good question, Maya. So currently it appears that the case rates here in Monterey County may be leveling off. And what I'd like to point out is that there seems to be some good signs in other parts of the statewide, and also in the Bay Area region, the case rates seem to be declining. So given that with prior surges, Monterey County has lagged the state and other counties in the Bay Area by about 2 weeks. Hopefully, if we continue to get as many people vaccinated as possible, people continue to get their boosters, and if we can continue to use effective strategies like using face coverings, hopefully we will also soon be able to see a decline in the case rates here in Monterey County.
Thank you. Another question for you. We haven't talked about the difference between in case rates with vaccinated and unvaccinated residents in terms of illness, serious illness or hospitalization. How is that? Is there still a big difference between vaccinated and unvaccinated?
Thank you, Matt. Good question. So there still is a difference between case rates and hospitalization rates between vaccinated and unvaccinated. So statewide, the state continues to report that individuals who are unvaccinated are a much higher likelihood of getting COVID than individuals who are vaccinated. And similarly, people who are unvaccinated are a much higher rate of being hospitalized, representing severe illness, severe disease from their COVID infection, compared to individuals who've been vaccinated with a much lower likelihood of being hospitalized. And here in Monterey County, we're seeing similar evidence, and that evidence shows that here in Monterey County, among Monterey County residents who are vaccinated are less likely to get COVID. They may still get COVID, but similarly, people who are vaccinated here in Monterey County are less likely to be hospitalized or less likely to have serious illness. So getting vaccinated the vaccination continues to protect people from serious illness and protect people from dying from COVID.
Thank you. Any other questions for Dr. Moreno today before we leave? There was a follow-up question regarding the Johns Hopkins analysis, and I'm going to forward that to Dr. Moreno for a different response, for a more thorough response. So any other questions right now for Dr. Moreno before we let him go? All right, thanks very much, Dr. Moreno, for joining us today.
All right. Thank you, ma'am.
And now we're going to move on to another COVID topic, but a very helpful topic. We're very pleased to have Jose Chang with us from the Agricultural Commissioner's Office. This Thursday, there's going to be a distribution of N95 masks and sanitizer for our agricultural workers. And Jose, I'm hoping you could tell us more about that. And then also talk about the plans for a farm worker resource center.
Yeah, thank you, Mayor. Good afternoon, everybody. Jose Chang with the Monterey County Ag Commissioner's Office. And so, as Mayor mentioned, tomorrow we're going to have a distribution event for personal protective equipment. It's going to start at 9 a.m. in the morning, and the distribution of the personal protective equipment will include surgical masks, N95 respirators, hand sanitizers, as well as we have children face masks. And all of that is going to be distributed in our office in King City. And the location in King City is at 522 and King City. And there is no cost to the agricultural employers and agricultural employees. And all of this PPE is going to be distributed on a first come, first served basis. And ultimately, it's going to be depending on available stock. And the reason that we do this, it is ultimately to protect agricultural employees, which is something that we have been doing since 2020. Although, we have this scheduled distribution event tomorrow, we have been, for the past 2.5 years distributing on as needed to agricultural employees and employers whenever they request for some of that PPE, and we have them, we provide that to them. We have also been working in terms of the personal protective equipment. We have been working with the primarily with the Center for Community Advocacy, CCA, to help us directly distribute PPE to the community members, directly on their hands of the community members. And this is something that we have been, it has been ongoing for the past 2.5 years. And they are, up until today, still helping us distribute, directly to family members of agricultural employees, distribute that PPE. The distribution event for tomorrow, we have approximately 100,000 N95 respirators that are going to be distributed. And we have approximately over 500,000 surgical masks that, it will be distributed then for this event tomorrow. And the hand sanitizers, we have roughly, we are just getting some stocks from Cal OES, and roughly we have about 10,000 that are going to be distributed tomorrow. We will have another event at the end of the month. I don't know the specific time for that event. So that is in regard to the distribution event, Mayor. and so that is happening tomorrow, 9 a.m. And it is important to mention that we are going to have staff available in both English and Spanish, in case to help navigate agricultural employees, how to get that PPE for their protection.
Jose, could you give the address in King City again? Had a couple questions.
Yeah, the address is 522 letter N, 522 N King City.
N Street?
Yes, N Street. Yeah, I'm sorry, N Street.
No, that's all right.
Yeah.
And then I had a request, if you could provide the same information about this distribution in Spanish for our Spanish language stations.
To say it in Spanish?
Yes.
Absolutely. Mi nombre de nuevo es José Chang y el día de mañana, el 3 de febrero, que es jueves, vamos a tener un evento de distribución de equipo de protección personal y el equipo de protección personal va a ser primordialmente para la distribución de los trabajadores agrícolas y también como para los empleadores de trabajadores agrícolas. El evento comenzará mañana a las 9 de la mañana y este evento del equipo de protección personal que vamos a distribuir, tenemos respiradores N95, tenemos mascarillas de uso, de solo un uso, y también tenemos hand sanitizers. Y todo eso va a ser distribuido, va a ser tenemos la cantidad que tenemos es limitada y va a ser la primera persona que venga, la primera persona que va a ser servida hasta que no tengamos este equipo de protección personal. También estaba mencionando de que hemos también tenido este tipo de distribución desde que inició la pandemia en el 2020 y hemos tenido una cooperación y colaboración primordialmente con la agencia CCA, o el Centro de Comunidad Abogacía, creo que es en español, y ellos nos han ayudado directamente a distribuir también a equipo de protección personal directamente a las manos de las familiares de trabajadores agrícolas y también como a sus hijos. También quiero decir que en el evento de mañana también tenemos mascarillas para niños, y también van a ser distribuidos para los hijos de los trabajadores de campo. El evento de mañana la dirección es 522 calle N en King City. Y este evento es vamos a tener 2 este mes. Este es el primero de 2 eventos y dependiendo en la disponibilidad de equipo de protección personal, vamos a tener más en el futuro, pero también nos estamos teniendo ahora porque los trabajadores de campo ya están empezando a regresar para la temporada de cultivos.
Thanks very much for saying that, if you're going through it all again. I do have a question. Is there an end time for the distribution? You're starting at 9, but is there a time you're wrapping up?
Yeah, it's going to wrap up at 3 p.m. Although past experience, indicates that probably is going to end sooner because, there will be, as you know, there is a high demand, especially for the N95 respirators. And this is the first time that we're going to, we have done this before, but it was for smoke, related issues. But this time it is specifically distributed for, the protection against the COVID-19. And so we think that it's going to be over before 3 p.m. to be honest with you.
And do you think you're going to give away all the supplies that you have?
Absolutely, yeah. So everything is going to go, we will give everything away, but we will have a second one at the end of the month. And it is something that I mentioned in Spanish, that we're going to have a second one because, a lot of the agricultural employees are beginning to return for the growing season. And so many are already coming and, so we need to provide this, this PPE directly in the hands of many of the workers that are coming back. And so by the end of the month, we will have another event and we will announce that through our Facebook, our website, and through you, ma'am.
Thanks very much for running this all down. Are there any other questions for Mr. Chang before we go on to our last topic? I see none. Thank you so much for sharing, and I hope all goes well. All right, and for our final topic of the day, last but not least, we're very pleased to have Jennifer Williams Carpenter from the Natividad Foundation here today to talk about really an extraordinary gift that has come to the hospital that is, I just find it so touching that the family of the person who is being honored by the gift there's such a great connection with the hospital here.
Thank you for including me today. And I am very excited to be here and share something wonderful with all of you, which is that Natividad Foundation has received a $1 million gift to memorialize the life of a nurse at Natividad named Nora Dowd. Mrs. Dowd moved to the US in 1927 from Ireland at the age of 8. And in 1939, she was living in New York, and the World's Fair happened to be in New York, and she met her future husband, Thomas. They went on to be married in 1940 and had 3 sons, Edward, Thomas, and James. And then in 1952, they moved their family to Salinas. Nora, who the buildings at the hospital will be named after, the mental health unit, she went on to become a registered nurse after graduating from Hartnell. She was active in Sacred Heart Church and in different organizations that benefited children and families. And our donor, Edward M. Dowd, Nora's son, said that he has great memories of Sacred Heart and going to high school at Palma in Salinas. And this is his opportunity to give back to Salinas with a gift that celebrates the life of his mother. This gift conveys to the family the memorial name Nora Dowd Mental Health Unit at Natividad. And also the funds will be used to improve 3 existing outdoor spaces at the hospital. There's an existing main lobby courtyard that every visitor can see when they come in. The staff can see it, and there will be improvements made to that space, as well as 2 spaces on the mental health unit, an existing exercise socializing area for the patients, and an area where they can currently see outside, but they don't go outside. We call it the plant area, but it will be called the healing atrium, and there's a healing garden. So those spaces, the 3 spaces, comprise about 7,400 square feet, and the gift of $1 million will fully fund those improvements to existing spaces. Ed Dowd, the donor, says that he likes to give money to places where a large infusion of cash can create change that wouldn't be possible otherwise. And we know at Natividad, that's the case. And Natividad, it's the place for him to give his money. He said that he is excited about the gift in memory of his mother that allows him to make sure that her legacy of love and caring is continued at Natividad. And philanthropy is what allows him to bring beauty to every patient, staff member, visitor at the hospital through these new healing spaces that we will have at our public hospital. We are very grateful to Edward for giving this donation and for remembering his mother this way. And we're excited to be able to honor her with the naming of the mental health unit and improving those 3 spaces.
Thanks very much for sharing a bit about her life and why this donation is important. I also think at a time where we are in the world at this moment in time, calling attention to the mental health unit and bolstering those services really hits the nail on the head, for lack of a better term, of things that are needed right now.
Yeah, we have about 600 admissions each year to the mental health unit and about 2,400 patients that come into the emergency department that need mental health services. So this is a critical service at the hospital that has sometimes been overlooked by the foundation and philanthropy. And this brings a striking light to that unit and to the patients. So we're very grateful for that as well. As you mentioned, at this time, people are they're struggling with mental health, and we all understand there's a shortage. So it brings a new focus to the patients in the unit, and the timing is great for everybody. And we get to celebrate the life of Mrs. Dowd at the same time.
Thank you so much for sharing that. And I don't have any questions for you. If there are any questions that come in after we're off, I'll be happy to send them your way. Thanks for joining us. And thanks everyone for being on the briefing today. Our next briefing is next week. We'll see you then.